Welcome back to the OHSU Effect Inside Health and Science. Let's get right to our guest now. Dr. Diana Wu is a reproductive endocrinologist in the OHSU Center for Women's Health. She's dedicated to helping the many men and women who face fertility challenges develop an informed, individualized treatment plan that considers their personal history and, of course, their wishes. Her research interests include the impacts of environmental toxins on male and female reproduction and factors affecting the outcomes of fertility treatments. Good morning.
Good morning.
So first, how do you define infertility?
Infertility is defined as the inability to conceive or achieve a pregnancy after 1 year of having regular, unprotected intercourse.
So after a year, should a couple who's having difficulty conceiving seek your help, or what would you recommend?
Yeah, certainly. After a couple has been trying to conceive for 1 year or more, they should certainly start considering an infertility evaluation or testing, and that could be done with either their OBGYN or with a reproductive endocrinologist. If the female partner is 35 years or older, however, the infertility evaluation should start after about 6 months of not achieving pregnancy rather than waiting out the full year so that there's not a delay in providing potentially needed treatment. And also if there are other known reasons to suspect an underlying fertility problem, such as irregular periods suggesting that there's irregularity to ovulating or not ovulating at all, or other fertility problems such as endometriosis or tubal disease or pelvic adhesions or scar tissue, then the couple should also consider initiating treatments prior than a full year of not being able to successfully conceive.
Sure. I want to talk more about that fertility evaluation in a minute. But first, I want to ask, what are the most common causes of infertility?
About 25% of infertile couples have more than one factor causing infertility. So it's very important for both the female and the male partners to present for the initial evaluation. Problems with ovulation is very common. So that accounts for about 25% of infertility cases where the woman has irregular ovulation or is not ovulating at all. And about 40% of infertile couples, the male partner is either the sole reason or one of the contributing causes of infertility. And the other factors such as tubal disease or scar tissue within the pelvis can also account for about 35% of infertility problems.
What about those environmental factors, like, say, smoking or something?
If all other testing comes back normal, about 10% of couples will fall into that unexplained infertility category. And we're finding out that more and more potential reproductive toxins in the environment where you encounter in the workplace or at home can certainly contribute to infertility in both the female and the male partners, a lot of which causes cannot be clearly identified with our basic testing.
Let's talk about that testing. What does a fertility evaluation entail?
Okay, so again, about 25% of the couple face an irregularity in ovulation or not ovulating at all. So the physician may start with getting a full history of the woman's menstrual cycle, eliciting whether she is ovulating regularly, asking questions about menstrual pain, abnormal vaginal bleeding, and other medical or surgical histories, which may play a role in, regularly releasing an egg each month.
And what would the male partner have to do here?
To test whether there's any abnormalities in the sperm parameters or sperm function, a simple semen analysis can be done, and the male partner will collect a semen specimen in a cup either by masturbating at home or in the physician's office. And the semen sample can also be obtained actually during intercourse using a special condom that the physician can provide. The lab then analyzes the sperm parameters, which are the sperm concentration or count, the motility or the movement of the sperm, and the morphology, which is the appearance or the shape of the sperm.
You mentioned that if a woman is over 35, she should probably come see you a little sooner. So how does age affect fertility?
More and more women are now delaying childbearing due to college, postgraduate studies, and subsequent careers. And so there's really an increasing number of women in their mid-30s or into their 40s who are attempting pregnancy, and myself being one of these women. So women do need to realize that the natural fertility does start to decline in your mid-30s and accelerates in your late 30s and into your 40s. And unlike men who produce new sperm daily throughout their lifetime, women are actually born with all of the eggs in their ovaries, and fertility starts to decline with age because there are fewer eggs remaining in the ovaries over time, and the quality of the eggs remaining is also lower as they start to accumulate more and more mutations or chromosomal abnormalities. There are actually now several very good blood tests and other evaluations that we can do to give you a sense of what your ovarian reserve is, which reflects your age-related reproductive potential.
What kind of treatments are available?
Depending on what the cause or underlying etiology of the infertility faced with a couple, the treatment can be as simple as an oral fertility medication to help induce ovulation in the woman, followed by just timed intercourse, or if there's a mild male factor that was determined to be the cause, we can wash the sperm specimen and deposit it at the top of the female's reproductive tract to increase the number of motile sperm or moving sperm at the top of the uterus, to also facilitate the movement of the sperm to meet up with the egg quicker.
So where can families go to learn more about fertility treatment options or to get a hold of you, make an appointment?
One main website I would recommend that patients visit is the American Society for Reproductive Medicine website, which is www.asrm.org. Couples can also visit our website, the OregonFertility.com website, and they can also access our website through ohsu.edu/fertility. And on the website, we also give dates for our open houses where couples can actually come and meet our staff and all of our faculty members to talk about different options.
Dr. Diana Wu, thank you.
Thank you.